Hey guys, it's Dr. Price with Action Potential Mentoring, and I want to give you a really high yield TQ that you can often see on step 1 and step 2 of the USMLE. So if a patient presents with sudden onset of suspected arterial occlusion, and remember you want to look for the 6 P's, so the stuff that's like pulselessness, paresthesias, pain, all that kind of stuff. If you see that immediately, you want to start this patient on heparin if they have a high clinical suspicion. So high clinical suspicion would be somebody that has a history of AFib. All of a sudden, they woke up this morning at 4 a.m. with sudden severe 10 out of 10 leg pain. That's going to be a classic presentation of acute limb ischemia. These patients immediately go on a heparin drip. You're going to want to get their PTT up to 60 to 90, which is the therapeutic range. So you may have to bolus them in addition to the heparin drip. And this is something we see all the time in the hospital with vascular surgery. You want to be careful on your exam that you don't perform ABIs or perform any kind of additional testing. You want to immediately start them on a heparin drip if you have a very high clinical suspicion for acute limb ischemia. You do not want to wait because time is going to be muscle. And if a patient has long enough time of acute limb ischemia, it can cause irreversible damage to the surrounding tissue. So I hope that helps. I hope that saves somebody's leg someday that has acute limb ischemia, and we'll talk soon.